tonight, the basketball world is in shock. 18-year-old Bronny James, the son of NBA star LeBron James, suffered cardiac arrest during basketball practice at the University of Southern California.
According to a family spokesperson, Bronny's heart suddenly stopped beating. He's an incoming freshman for the school's basketball team.
So what happened to Bronny James is a concern for many families with young athletes. So let's bring in Dr. Allan Stewart. He's chairman of surgery and medical director of the Cardiovascular Institute at HCA Florida. Dr. Stewart, thanks so much for being with us. We had a lot of coverage about cardiac arrest not too long ago when DeMar Hamlin of the Buffalo Bills suffered one in the middle of a game. But for those people who maybe don't recall or didn't hear about this information, cardiac arrest, not the same thing as a heart attack, right?
Exactly. So a heart attack can cause cardiac arrest, but cardiac arrest has many causes. Cardiac arrest means that the heart is no longer functioning as a pump to bring oxygen and nutrients to the body. Now, a heart attack means that one of the arteries of the heart is blocked, which can cause some of the muscle to either get damaged or die. That's a little different. And if untreated, a heart attack can progress to cardiac arrest. It's very, very unusual for an 18-year-old kid to have a heart attack. So what's more likely is his cardiac arrest was caused by either overexertion, meaning that the electricity of his heart went a bit haywire because of the intensity of which he was exercising, or maybe there's something structurally wrong that was only discovered by that level of exercise, perhaps some sort of congenital defect. Time will tell, and I'm sure all the appropriate tests will be done on Bronny. But the upside is that his family spokesman said that he's no longer in the ICU and is recovering fine. In the event that it is just an electricity, a random event from maybe dehydration and overexertion, he should be able to go back to playing basketball without any worry.
Now, how common, doctor, is this sort of thing in young athletes, and what are the symptoms?
So unfortunately, there aren't any symptoms in advance. As this family said, his heart just abruptly stopped working. It's important to realize that these athletes are exercising under a tremendous exertion, and often without adequate hydration, and so it would lead really to very few symptoms. Maybe he'd be short of breath for a minute or two, not catch his breath, and then just drop on the field. It happens a few thousand times a year, and that's why it's very important to have defibrillators, these AEDs, readily available in gymnasiums, in schools, and in stadiums.
Yeah, a situation where really every minute, every second truly counts in getting the help to those people who are affected. Now, cardiac arrest, can it be prevented by screening athletes? So many of these athletes, we imagine, go through tremendous physicals before being allowed to compete at the college level, but even younger, middle school and high school also goes through these screenings as well. Could it detect something like this ahead of time?
Yeah, there are tremendous testing that's done for the NBA, for the NFL Combine. In high school and college, I mean, it's less. There are lesser tests being done, but certainly if there's a congenital problem, meaning a birth change in his heart, that could be discovered by an echocardiogram. And I would encourage any parent who's allowing their child to compete in an intense sport like a basketball or football at the high school or college level to have a baseline echocardiogram, which is just an ultrasound of the heart, to make sure that there isn't a rare defect that can be prevented. But again, if this was just an electric misfiring, there's very little that can be done to determine that ahead of time.
Dr. Stewart, thank you so much for your insight tonight. Of course, we wish Bronny James well, and we're thinking about his family. Thank you, doctor.